Proposed legislation could give you better access to hospital medical errors. I'm Jill Horner. This is Comcast Local Edition. With me this hour is New Jersey Assemblyman Dr. Herb Conaway, representing the 7th District. Thanks so much for being with us.
Glad to be here.
This would provide a hospital-by-hospital account of what actually happens within that hospital setting. But tell us a little bit about this legislation, which you've actually sponsored.
This bill will give consumers information about the kinds of I would say errors, mishaps, outcomes which are less than favorable that occur in the hospital, many of them having to do with surgery. So these are things like going in and having your doctor give you a collapsed lung, doing a routine procedure. Now, having a blood clot in your leg after abdominal surgery, let's say, or having a fall after surgery which caused you to break either another leg or the leg they operated on, or having a wound infection. These kinds of things, which are complications of procedures, will happen at different rates across different institutions depending on who the operators are and how well care is rendered in the institution. Now,
isn't this information already reported?
It is reported now, but right now it's reported anonymously. It's not hospital specific. And as the legislation was originally designed a few years ago, the idea was to not have the information in the public space to encourage reporting. So that if doctors, nurses, hospital administrators knew of something, they could report that information, understood that the Department of Health and Senior Services would keep that information secret, if you will, and then analyze that information across the state, and then go to the hospitals and say, look, as we compare hospitals across the spectrum, your hospital seems to be having a problem in this area or that area. We want you to put an action plan together. We're going to come back and evaluate you on that and make sure that you're making appropriate changes.
Is there a concern, though, if this information is made public, that people can search the records, one, if they decide to do that to begin with, and two, that this information could somehow be taken out of context? You're not there in that operating room to know what happened.
Well, you're right about that, and indeed, all procedures that happen in a hospital setting have attendant risks. So if you have an operation, there's a risk that you'll have a blood clot that follows that operation. If you have an operation, there's a risk that you'll have a wound infection, and those risks are not reducible to zero. Those things are going to happen if operations are performed on patients. The question is, in Hospital A or Hospital B, is Hospital B doing much worse in a particular category than Hospital A? And if Hospital B is, the thought is with this legislation is that the public ought to know. Perhaps people will make some decisions about what hospital they'll use for certain procedures based on that. I think there's some real doubt about that, by the way. And more importantly, it will sort of increase public pressure to make sure that hospitals are making the kinds of improvements that they need to make to bring these numbers in line with a normal baseline.
There is another component to this legislation as it relates to billing for certain procedures and the outcomes of those procedures. Explain to us how this component would work.
Well, there are a category of mishaps or bad outcomes, poor outcomes that happen in hospitals that are described as never events. Those are events that should never happen under any circumstances, and those include things like operating on the wrong person, operating on the wrong limb. You're supposed to have an operation on your right leg, the surgeon operates on your left leg. Leaving a foreign body in after the operation. So these are mishaps that should never occur under any circumstances. And the Center for Medicare Administration has decided not to pay hospitals when these things happen. We have put that in New Jersey statute, so it's also against New Jersey law to pay for those poor outcomes. Would
this potentially lead to non-payment for more prevalent things that can't always be prevented? For something, for example, like a blood clot, which in some cases can be prevented and in other cases can't.
Well, that is one of the controversies that may come up in the future. I believe that there is a difference between a never event, which in practice, no one bills for that anyway. An event that you cannot eliminate entirely, even under the best of circumstances. And if there's an attempt for non-payment there will be controversy around that kind of a proposal.
All right, I know this is at the beginning stages, so please come back and give us an update.
Will do.
Thank you. We've been talking with Assemblyman Dr. Herb Conaway of the 7th District. I'm Jill Horner for Comcast, the Local Edition.